Greetings, everyone, and welcome back to our GetExpanded live discussions. This is our 13th live call, and today we're joined by our special guest, Hallie Bulkin. For those of you who don't know her, Hallie Bulkin is a business mentor, clinical mentor, certified pediatric feeding specialist, certified myofunctional therapist, and speech-language pathologist. Hallie has a passion for sharing knowledge with her colleagues in the pediatric feeding, orofacial myofunctional therapy, and private practice business spaces. And joined with us today is our co-host, Dr.Julia. She's a general dentist who has pivoted into the space of supporting parents as they navigate all aspects of oral and airway development for their kids. Please be sure to check out both of their socials, which we'll leave in the description below. And towards the end of our discussion, we'll wrap up with a live Q&A. So be sure to drop your questions in the chat as we go on.
Thank you. Well, thank you so much for having me here. I know that Dr. Julia and I have connected in the past, and so it was really exciting to get this invitation to join you all here. And so, I'll turn it over to you so you can start and let me know where you want to go. But I'm excited to be here.
Thanks, Hallie. Yeah, I'm new to the GetExpanded community, and I am joining here with the intention of starting to bring more conversations to expansion in the pediatric space. And so, from everything that I have watched and learned, Hallie is, for those who don't know, a legend in the world of all things oral development and overall development, really. And so for me, Hallie is the perfect guest to come in here from both her professional experience and her personal journey, because those who have been part of the GetExpanded community have had the chance to hear from Dr. Koval. So I will throw out a little plot spoiler that Hallie has firsthand experience working with Dr. Koval. So we will get to that. Normally, my inclination is to dive right in and get to hear your own personal journey. But in this case, I think it would be so amazing if you could explain to those of us who may not know about the world of pediatric feeding therapy and orofacial myology, and how just a little explanation, I realize that can go for a long time, but bring us up to speed on how important this work is. What is this work, first off?
Absolutely. So I think it's really important to explain, like, I am a speech pathologist by trade, speech language pathologist, I should say. And I started in a more traditional setting, and I pretty quickly realized something felt off. And so I was helping kids, right? And I was like working in the moment, but I realized that I wasn't getting to the root cause of what was going on with these kids. And that really is what threw me into the pediatric feeding space. And then I later fell into the myofunctional therapy space. And so let's break both of those down. So like you were saying, like, let's make sure everybody understands what we're talking about. So pediatric feeding at its core is really about helping children eat safely and efficiently. And so they enjoy mealtime and their families enjoy mealtime. And so we look at things like sucking and chewing and swallowing and transitioning from liquids to solid foods and managing picky eating, which is something they've thrown around a lot, or in some cases, more complex feeding challenges. But when you really understand feeding, you start to realize it's not just about the food. It's actually about like how the muscles of the mouth are functioning, how the child is breathing, how their nervous system is regulating, and whether their anatomy actually supports like safe, effective feeding. So feeding therapy really becomes this window into their entire operating system, if you will. Now, when you add in orofacial myofunctional therapy, that really zooms in on, I like to say, like the why behind the why. So it focuses on optimizing how the muscles of our face and our mouth function at rest and in motion, right? So we talk about like, where does the tongue live at rest? It should be up in the roof of our mouth. And are we breathing through our nose or are we breathing through our mouth? Because we want to be breathing through our nose. How are we swallowing? Like, how are we prepping the food and getting it ready to be swallowed? That's all part of the swallow process. And how do our lips and our jaw actually support stability for all of the above? Because those patterns are really what shape everything from facial development to airway health to sleep quality. And so hopefully that kind of helps give an idea of what they look like separately. But what I like to do and what a lot of people don't really typically do in this space is connect the two. There's a connection that I feel like a lot of people miss, and that's that feeding is one of the earliest ways that we see dysfunction show up. myofunctional therapy then explains like why that dysfunction exists and how to change it long term. So if a child has poor tongue mobility, low tone or poor coordination, they've got that mouth breathing we mentioned, right? Or patterns of mouth breathing. Maybe they have a mixed mouth and nasal breathing pattern, or just structural limitations like a high narrow palate or a tongue tie or something along those lines. You're going to see it in feeding first, typically. And if you don't address the underlying issue, which is function, right? It doesn't just stay a feeding issue. It quickly becomes a sleep issue, sleep disorder breathing, orthodontic problems, right? As you know, speech issues develop, and then those long-term airway and health concerns. So what I do now, right, is I train clinicians to stop treating feeding as an isolated skill and to start seeing it as part of a much bigger system. Because when you start to ask questions like, why is this child struggling to do something that should be so second nature, so instinctive, right? Then you start like chasing symptoms and trying to just fix the symptoms and slap a Band-Aid on them. And you start going like, okay, what is the root behind all of this? And how do we create like real lasting change? So in short, to sum that all up, like feeding therapy shows you like the problem. Myofunctional kind of helps you solve it at the root. But that's where like as feeding therapists, we can integrate the two to do that, because I call it feeding with a twist of tots and myo. Because many people in the feeding and myo worlds know this, but just to let everybody know here, feeding typically is something we start at birth. We can do myofunctional therapy when they're little, but it falls under the realm of feeding therapy. And like traditional myofunctional therapy intervention doesn't really start until a child has the cognitive ability of like a 4 or 5-year-old usually. So people go, well, what do we do before then? Well, feeding therapy with a therapist who's trained in both and understands how to look at it and combine the two.
I love that. That was such a good summary because it is something where you do feel like that should be so instinctual that, we're born. We should know how to eat. We should know how to breathe. We should know how to sleep. This should all come very automatic.
Yeah.
And for those who have experienced firsthand a child who is not seeing those progress automatically, it is such a welcome resource to have more providers that offer resources in this space. And so, again, Hallie has not only walked the walk herself, but she is changing the kind of broader institution by training other providers to think about it this way. So, this is amazing. So, with that in mind, now that you know Hallie's kind of profession and where she stands, let's dive into a little more about your personal journey and kind of what led you all the way to finally meeting with Dr. Koval. You can share that story.
Yeah. Okay. So we'll talk about myself, but I'm also going to bring my kids into this.
Perfect.
My first was born, and we had very painful breastfeeding for the first 13 months of her life. And then at that point, we stopped with breastfeeding and she was transitioned over. Later found out she had a tongue tie, and we had been to lactation, we had been to professionals. Nobody ever looked under her tongue. Nobody looked in her mouth. Nobody identified that she had tension throughout her body. And I figured that out when I went and took my first myofunctional therapy course, which was around that she was about 23 months old or something. I came home, I flip her over. I'm like, oh my gosh, this kid is tongue and lip tied. Anyways, fast forward, take her to an oral surgeon, prep her, oral surgeon, post op, all that fun stuff. And we did release the tongue. Immediately, symptoms improved. But, she has a high narrow palate. She has all your classical symptoms. And so at age 4, she went into an ALF appliance with a colleague of mine up in North Bethesda, Maryland, when we used to live up there. What was incredible was her CBCT showed that she had very full sinus cavities. Her terminates, everything looked inflamed and very little space for her to nasal breathe. And so then the pandemic happened. She was about halfway through her ALF appliance. We were going to do it for a year and see where she was. That came out about after a year after it was put in. And when we did a follow-up CBCT, which may have even been a year later, she was still everything was open. Her nasal breathing looked beautiful. She had the ability to finally nasal breathe, right? And so, I know we'll talk more about this, but it's really challenging to work with a child who can't breathe and expect them to make progress in any type of therapy. She then went on, when we moved down here, I was presenting her case with some colleagues at a conference and to dentists in the airway space. And they were like, she needs more expansion. And I was like, okay, all right, let's
Let's
do it.
let's pause for just a
Yeah.
brief moment and just explain too, because the ALF is not a traditional expansion device. It does unwind some cranial strains and allow for the tongue to more naturally sit in the roof of the mouth and works to address some of the tension that's holding back growth. So it's reasonable to understand just that nuance as we go through this that she went through, and she saw tremendous benefits, but you were told expansion was still on the docket here.
Yes. And I will say, like, her tonsils within 3 months went down to normal size. They were almost kissing and they went down to almost like size one, or they were size one. So I was looking at her, like, in her mouth. I'm like, it's cold and flu season. This was the fall before the pandemic. So, like, I was like, okay, they're still in school. Like, this is a kid who gets sick all the time. She's not sick. Her tonsils look healthy. What is happening? Like, this is so cool. And she was in myofunctional therapy. And that was one of the things I liked about the ALF appliance was it leaves the palate open. And she also was like a little bit of a sensory kid and certain sensory preferences. And so I was like, I don't know what's going to happen. It really kind of calmed her down. Like, her nervous
Mhm.
system was really in check, which was so beautiful.
Amazing. How old was she when she started this?
Or
Okay,
Yeah. So she did that from
amazing.
4 to 5. And then we were down here and I presented fall, I think that was like October 2021 or something. And so at that point, I finally took her, I think in the spring for more expansion. I had to drive like an hour to another dentist down here. I couldn't find anybody locally. And she went into a Hyrax with forward growth component, like customized. So at that point, it's your more traditional expander, but with like a forward growth customization. And I don't know, she did great and everything, but they put her in a myo brace afterwards, which honestly she would choke on about an hour into sleeping and spit out. And I was like, well, this is really not, that was after the Hyrax kind of hold the growth.
Mhm.
Um, and so that was her. She was in that for maybe 6 months. That was her journey until we met Dr. Koval. And I was like, she still needs, I'm pretty sure she needs more. My younger one went into the same appliance with the dentist in North Miami at age 4. Now, she was a kid who had upper respiratory issues like from birth. So she had croup 9 times as a 3-year-old, and nobody up north in DC could figure anything out with her. And, she was 2 in the pandemic. She was 3 when we moved down here. And I was like, something has got to give. Like, we've got to get this kid off steroids because this is just this like catch 22 of like, we're killing your immune system to then introduce new things again. And like, we know steroids can be helpful, but also they can not be so helpful. So once she went into expansion, she stopped getting sick as frequently, but we knew with her, she was going to need a phase 2. And so that at that point that both girls, she had the same exact appliance as Lily, my older one. The doctor there said, well, I don't always put them right into a Hyrax at 4. We could try myo brace first. And I was like, I really want a fixed expander. And I told her about the airway issues. And she said, oh, she's like an airway crisis. Like, we're going right into fixed appliance. And I was like, fantastic. That's what we're here for. So we did, and it was very helpful. But then phase 2, that's when I found Dr. Koval here in Boca Raton. And I was like, okay, you're the go-to, you're the ortho. I'm like watching all of her cases on social media. And I'm like, let's start with the girls. And then I grew a pair of balls and was like, I was like, okay, let's talk about MARPE. And she's like, oh, okay. And honestly,
You sent in the test humans.
right.
No, I'm
I
just
know. I'm
kidding.
like, here's the test subjects. Okay, great. And I mean, there's just like more of a traditional
No,
expander.
I
I didn't have
understand.
MARPE, but at the same
Yeah.
time, I was watching colleagues go through MARPE, and I had traditional expansion as a kid and braces. I had a permanent retainer behind my upper and lower teeth, for years. And I remember being like 13 or 14, and the dentist, who was a family friend, was like, this will fall out by the time you're 20. At 30, I was like, you all keep telling me it's really not easy for me to clean behind my lower central incisors. Can we please just take this out? Like, I don't need this here anymore. As soon as it came out, my teeth started to shift. And I was like, oh, OMG. I mean, and this was before I was in the myo world. Okay. So
Right.
I immediately went back and was like, my teeth are turning. And the dentist's like, no, it's fine. They're not turning. I'm like, no, I can see them shifting. Clearly my tongue is pushing them into that position. So fast forward, 10 years, almost like 9 years later. And finally, I went through DNA Vivos as well, which did get me some more space for my tongue, but arguably did not like what I needed. And I think I also retracted myself in the last couple Invisalign trays that I used. When I was presenting back in October 2021, I remember a couple of the dentists being like, don't use the last 3 to 4 trays. Like they tend to retract the
Mm,
teeth with Invisalign after like, you've gotten some, whether it's teeth flaring or actual true dental expansion or, what a skeletal expansion. And I was like, well, just finish those up. And I threw them out. So I can't even reverse this. So at that point, I was like, okay, I'm clearly not done. But part of my issue was my maxilla was like turned in slightly on one side. And so unlocking the maxilla to actually get proper expansion and to bring my jaw into proper alignment, you know, I was like, this is not strong enough of an appliance to do that. And so I think in the back of my mind, I knew there was like a MARPE down the road somewhere. And so I watched people for several years before jumping in. What I will say is it's not as bad as it seems. It feels very invasive when you're on the front end of it. Once it's in, I had immediate relief. So after I woke up a couple times and I started to get TMJ pain and I couldn't open my mouth to even chew for a couple hours. The second time that happened, I was like, and this was spread out by months, but the second time I was like, that's it. I'm in because I know where this is headed, right? If I don't do something about this now. And so that's where I went to Dr. Koval and I was like, all right, talk to me about MARPE. Like, am I a candidate? Now I had nasal surgery in April of 2022. So she actually had to review my case and like look at everything to see if I was a candidate. And so thankfully I have a very thick bone and my hard palate's very thick. And she was like, you're a candidate. I'm not worried about any collapse or anything with because I did have a septoplasty, a nasal turbinate reduction, and a nasal swell body reduction. And at the same time, I was like, hey, this little bump that I developed in childcare in pregnancy, can we fix that? And so I ended up having a rhinoplasty at the same time, which is where the question of is the septum and the nose in general, like, are we going to disrupt anything if we proceed with MARPE? So, I mean, I had it put in August of 2025. So we are well into it now. Did all, Dr. Koval, she talks about how she does the piezocardicotomy. Honestly, the thing that hurt the most was getting numbed. Like the shots in the palate,
amazing.
that hurt. I
Yeah.
felt nothing else. After that, even the pain, just managing it with like extra strength Tylenol for a couple days, and I was fine. And it's funny because I'm very holistic and I don't typically take Tylenol. And another holistic person who's gone to Dr. Koval, I was talking with her. She's like, don't be a hero. She was like, I regretted not taking it because once you get to the point of being in pain after the procedure, like it's too late. And to try and catch up with the pain and resolve the pain, it's by the time you do that, like the pain's gone anyways. I was like, okay. So I did take the Tylenol and rested for a few days afterwards. But it was
That's
a
one thing
really,
that I actually do love about your journey too, because I feel like that's one of the common sticking points for at least a lot of parents is if they're still on the search for trying things as holistically as possible, there are sometimes these points in time where something that someone who's recommending something for airway might conceptually conflict a little bit with the big picture of how normal philosophies of healthcare are at home, and sometimes we have to just cross that threshold. I as a general dentist, I worked for several years in a biological dental practice, and I understand that community and I understand that philosophy and support it 100%. But I do think that that's just always interesting, and I'm glad you talk about this on your podcast, and I'm glad you brought this into the community in case someone's still on the fence here, whether it be the Tylenol or whether it be considering sometimes these forces that are going to be used when sometimes we're wanting to gravitate towards the more gentle way to do something, and then we hit a point where we look at it and we say, well, I know where things are right now and I have a vision of maybe where things could be and how do we get there. So I love that that's part of what you share in your story when you do talk
yeah.
about all of this. Yeah,
Yeah, I mean, I
that's
believe
amazing.
a place for Eastern and Western medicine to work together, time and a place. And if you're really that stressed about it, I mean, you can detox the body from anything truly. So just have a plan in place, have a protocol in place that you feel good about, do it your way. But it's not healthy for the body to be in that much pain if you can also prevent it, like for healing. So in my mind, I was like, it's more important that I do not just feel all this pain for days when I can prevent that, when my body's, because we know inflammation is going to massively kick up and that's going to drive a ton of pain. And so, honestly, I really felt very little, if any, pain at all, which was great. And I tell people, I'm like, and I kept like a log with my own like day by day, like this is what I'm feeling. This is when I took Tylenol. This is when I did this. And I think it was like around, I don't know, like a week or two later when I went back to Pilates, whenever I got the clear, I don't remember when that was. It was interesting because I actually felt pressure in the back of like my occipital lobe, like the back of my head. I was like, oh, that's weird. I've never felt that before because everything's shifting, right? The cranial bones are moving. And it was very interesting. Everyone focuses here on the front on like the mid facial region and like how that may be sore and you may feel some pressure as things shift there. And I was like, yeah, I mean, I felt some of that and I expected that, but I didn't expect like when you lay down on the back of your head on like a solid surface to have the pressure back there. So that was kind of interesting. And it wasn't painful. It was just like, oh, that's there. Okay. Like, let me just be aware, let me just be cautious. The other thing that was really cool too is I remember Dr. Cabal saying, you might wake up in the middle of the night and feel like a ping when the front suture splits because when she does her piezocorticotomy, she basically opened the palate all the way up to the front 8 millimeters of, the hard palate because of the nerve up there, right? So she's like, I don't want to come too close to that nerve. And so the front has to split on its own. And I remember it was like 10 days afterwards. And they told me, oh, it might be a couple weeks, whatever it was. I guess my body moves fast. I expand fast. I heal fast. So I remember laying in my daughter's bed and all of a sudden I started like going, I was like, something's happening. Like I just like took a couple of deep breaths. I felt like this like little ping and I was like, that's it. That was like so uneventful. I was expecting this like wake me up at 3 a.m. in pain, like big event happening as like the rest of it splits. And it was just like this little little, I was like, that couldn't
Did
happen.
you feel like a release after that? Like you felt it building, but then it was a
I
really
felt like
light.
building up, but it was like maybe like 3 deep breaths. And then like the ping happened and there was like, yeah, like a release. And I was just like, wait, that's it? Like really, that's it? That was the whole thing? Like, okay. I mean, it was
Fascinating.
much, like I said, it was uneventful.
Mhm.
And I said to my daughter, I was like, I think the front of my palate just like split. But maybe not, because like I was expecting it to be like a way bigger event. So it was interesting. And at this point, I still have the appliance in. Everyone's like, oh my gosh, you have this appliance in your mouth and you can speak so clearly. Yeah, you get used to it, and they take the arms off once you're done with expansion. So that honestly to me was that was the biggest hurdle to get used to, was having like the arms attached to the appliance to, the teeth that it's secured to, because the food gets stuck there. Like that was my biggest hurdle. If nothing else, it was really challenging to suction my tongue then. Not that I'm suctioning my tongue much now, but if I try to demonstrate for somebody, I can at least do it with
Mm.
effort at this point. So yeah, that's where we are.
Amazing. Thank you for sharing that. I feel like for again the community here, they've gotten here a lot from the doctors themselves, and I know that's largely what the community intent is here, is to connect directly with the doctors, but it's also so helpful to hear about someone else who's walked the journey. And again, this isn't just someone else who's walked the journey. This is someone with a tremendous amount of knowledge of tongue function and oral posture and everything. So let's go back to that kind of your professional background and talk about in kids now. What is really the interplay between you? You gave us the intros so well about feeding being kind of the first red flags, and we're seeing that in development, and we know that there's dysfunction, and we're going to need some sort of support. So now, how do we see this interplay with the kids who are going to need some sort of intervention and expansion? What's the interplay there?
So the one thing I will start with is, if a child needs braces, they have a neurofacial myofunctional disorder. So every single child who needs any sort of expansion or braces because their teeth are not straight or their teeth are not coming in, and I'm not the dentist, right? So I don't move teeth for a living. We deal with the muscles that can influence teeth. But I see a lot of missed opportunities here, because expansion without therapy is incomplete. And therapy without addressing structure can also only go so far, right? It works both ways. And so people will say to me, well, what comes first, like the chicken or the egg? Like, what do I do first? Honestly, it depends on the case. And, yeah, I mean, I think it's like one of those things
I'm
where,
applauding that.
yeah, I'm like, who's sitting in front of you? Like, what is the kid, how much expansion do they need? Can they get their tongue up there right now? Can we start therapy and fairly expect the child to make some progress? Or are we asking them to work against a system that's working against them, right? And not working with them. So in some cases, we've recommended the kids start with expansion and then we start working with them. In some other cases, we've started working with the kid and then expansion is part of that journey. Maybe it's not immediate, maybe it's coming soon. It really depends. And how severe are their symptoms and how much is it impacting their daily life? And what is the parent's plan for them? Because at the end of the day, that dictates what we do in therapy. As much as we as therapists, clinicians, doctors, like as much as we want certain things for our patients, the parent is part of that evidence-based triangle, right? Like their experience, their goals is just as important as the research that we're looking at, as our clinical experience. And so we have to kind of like integrate all of that together to figure out like, well, what is this kid's journey going to look like? And listen, if a parent's like, I'm not doing expansion or I'm not having a tongue tie release or I'm not doing, okay, that's their choice. But we also have to have a conversation about, well, if and when we hit a wall and we can't make further progress, it might look like this. I don't have a crystal ball. I don't know, but I like to have those conversations up front for families that are kind of on the fence or like, absolute no, not doing X, Y, or Z, so that they know we're not just going to keep you in therapy indefinitely if you're not doing what we think is, if we hit a wall and we feel like we can't make more progress, right? And I think it's a very fair conversation to have. And I will tell you that like 98% of parents at that point that you hit that wall go, okay, we're ready now. Like, what is it do you think is the next step? Who else should we talk to? Because you've built the rapport and you've built the trust and they see their kid is making progress, but now they see their kid is struggling again. Right. And so I think it's all part of the human experience that sometimes we have to let people experience things their own way. And we can't just continuously dump education and our therapeutic treatment plan on them, just because that's what textbook should look like.
Yeah.
But anyways, on the flip side, kind of going back to some of this when I mentioned, if you expand the palate, right, and you don't retrain the tongue or breathing patterns, muscle function, right, the body's just going to fall back into old habits. And then we see that orthodontic relapse, which is so
Just like you experienced. Yes.
I've experienced it as
Yep.
I experienced it. I've seen patients come to us that have already experienced it. We primarily focus in pediatrics, but also in my private practice, we do see some adults. So we've seen the whole lifespan, right? Just for Myo specifically. And I've had adults come to me and say, I don't want an appliance. I don't want a tongue tie release. I just don't want to be in as much pain. Can you help me? Okay, sure. We can give you some exercises. We can work together to see if we can relax your muscles, teach you some things to do when you're in a certain, you wake up a certain way to help release things. And if that's your goal for yourself, then yes, we can help you with that. Anyways, on the flip side, right, if you're doing therapy, but the child physically doesn't have the space, as I was mentioning, for like proper tongue posture, you can't ask them to suction their tongue and expect that tongue's going to live up there, right? You're fighting an uphill battle. So the magic truly happens when both are done together. Like that is where we see that like real lasting change. But again, I go back to, we have to also respect the parents' wishes and their goals for their children.
Yeah, I was just smiling from ear to ear when you were laying that out because for me, even though I am a dentist, I've shifted in the last few years into the space of meeting with families, discussing, when they're feeling stuck, how can they, like, what kind of provider should they be working with? Who should they be working with? What kind of tools do they need? What's the order of operations? These are all questions that families have. And time again, I've really had to take my thinking hat of I'm a dentist with a set of tools and solutions off, and now think of this as sort of a coaching opportunity for each family because every child is unique, every family is different, what the parents are willing to do. All of the things you just said are a piece of the equation. And sometimes I just think we really miss that that opportunity to get the families decisions and their autonomy involved in the decision making. And I think that that's a missed opportunity for sure. So I absolutely adore that you just laid that out for us. That's gold to me, music to my ears. So thank you.
Yeah, well, all
Um,
the work that you're doing, just to jump in on
mhm.
that, because I know we chatted about that when you were kind of getting started.
Mhm.
It's critical because there's so much information out there now. Before it was like there's no information. I don't know how to research this. I don't know where to find it. And now I feel like there's a lot of people, but there's a lot of people on social media, right? More so than anywhere else. And there's so many different varying opinions. And so when families try to like case manage themselves or figure out, well, I went to this provider and they said this, and then I went to this provider and they said that, and this provider agrees with the first one, but but the fourth one agrees with the second. I'm like, okay, great. So what do you want? Is it right? But no one's asking them that. They're all just
Yeah.
saying, this is what I think you should do. So I love what you're doing because I feel like you're that intersection of let's case manage this and figure out what's the right next steps for your family. Right.
Yeah.
I love
And
that.
that's what, again, like, so grateful to JP and Patrick for opening up this type of platform where we can have these conversations that are going to directly empower parents and patients to make these decisions of what is going to be best for them. So, love that. Let's also, is there anything else about kind of, I know we kind of glossed over your daughter's journey, whether we want to dive back in and talk about their own expansion or kind of, again, the interplay with therapy and expansion for them or for any other kids, just to kind of revisit that in one more time before we kind of circle
Yeah.
back.
I mean, I think it's very interesting. So I look at Lily, my 10-year-old. She had the ALF appliance. It served us very well in the beginning. I almost feel like we probably should have kept it in longer until we moved into the next expansion appliance. I don't know. It's my younger one who started with rapid palate expansion at age 4 has a much wider jaw. And so just to see the difference, like even though I'm very happy we did the ALF appliance and it solved a lot of her issues at the time. I don't know. I wonder, like, what if we had started with like a rapid expander first? Would things be different? So it's just fascinating because she's been in 3 rounds. My younger one, Mia's been in 2, right? They're 2.5 years apart age wise. And the younger one's jaw is just so much bigger. So I'm like, again, it could also be structural, their skulls. Maybe it's just that because Mia's face does appear a bit wider. But that's been really fascinating. With and I kind of joke, I'm like, well, if Dr. Koval, if I knew about her in the beginning, like we just would have would have gone running to her. Like that's where we would have started. No, and I highly respect, the other dentists. Like one's a really good friend of mine and we moved away from there, but highly respect the other professionals we've worked with because everybody's on this airway journey and they're all willing to expand these children younger. And I knew going into it too, like nobody has a crystal ball. I don't know how many rounds we're going to need. And I think that's not discussed enough because I think a lot of parents go into expansion thinking like, oh, this is going to save us from having to have braces. Like this is one and done. No, my kid had 3 rounds and now she's in Invisalign with Dr. Koval. And my older one also, like, poor thing is like in Invisalign, probably, I think she's got like 83 rounds of Invisalign, whereas my younger, and that's after she already had some, whereas my younger one has like 50 something weeks of Invisalign. And again, like they started at the same time. The younger one, I guess, moved easier, faster, wider, whatever. So again, it's very interesting even to see it in my own 2 kids and how different their cases have been. But my older one, I will say, she became a really picky eater around 18 months, 15 months. She was eating everything before that. And then she actually had a really negative reaction to vaccines. She had 5 in one day. So we weren't quite sure like which one, but she got really sick. And she had chicken and fish that day. And after that, she wouldn't eat them. So I was like, I don't know if something like changed like on a chemical level, like with taste or what. I don't know. But for the longest time, she would eat chicken nuggets, which we call pre-chewed food. And that's not real. Like, I mean, it's real, but it's not like it's already broken down for you. So you don't really have to chew it very much. A couple years ago, I think when we started traveling to Europe, all of a sudden she became more interested in trying new foods. So I was like, that's it. We have to travel. But also, I mean, lined with like some experience.
Restriction for
Yeah,
travel, yeah.
exactly. Yeah, let's travel. So she did become more, exploratory with her foods. And now like she eats beef, chicken. My kids have always eaten veggies and fruits. So like that's not been an issue, but I could not get proteins in her very easily. So but she also I think she just didn't have the system, right? She didn't have the oral motor strength or, the correct bite at one point. And it just, between what happened when she was 15 months and then everything together, I
Just
think
to
that
kind
all,
of explain, like, you're saying that basically the chewing of those different things, if it
yes,
wasn't in chicken nugget form, it required a lot more chewing, and that requires a lot more coordination of the muscles. It requires the teeth to come together in a nice way,
yeah.
and there's
And
a
her,
lot more
like her
coordination.
nervous system regulation too, I think was a big piece of it because she's had a very heightened sensory awareness to, and like response to any type of seasoning. So you put like a little pepper on it And she would say, that's really spicy. You put any seasoning that's not spicy on, and she'd go, this is too spicy. And she just means it has too much flavor. So we had to but she likes salt, right? So it was like interesting too. And we've worked with like functional medicine and all this kind, all these kinds of things to make sure we have healthy guts and that we're not like, our minerals aren't low because we're seeking more salt and like all these kinds of things. So this is a much bigger conversation. But at this point, her expansion looks beautiful and she's eating pretty much anything at this point, that it makes it very easy to go to a restaurant. My younger one's always been a great eater, but she was born with tongue tie, lip tie, upper lip tie, both released at 5 days old, and very different journey. She also had torticollis. She would crawl, not really crawl, she would drag a leg behind her and scoot across the room very efficiently and effectively. We had her in PT very early, but we were kind of just keeping her milestones on track. She wasn't like totally falling behind, but also didn't crawl until I took her to an osteopath and a craniosacral therapist about 10 days apart. And she, after those 2 appointments, started crawling across the couch on all fours and then got up and, no, sorry, she was already standing, like pulling to stand and starting to coast, and then quickly like walked after that. But it was just very interesting to see, all these different specialists, the presentation of both kids. My younger one, while she had like the full body, gross motor things going on, even though we intervened early with the tongue tie, she still had that high narrow palate and she was the upper respiratory kid and she got sick a lot. And so there was just 2 different kids, but they both benefited very much so from expansion and myo and feeding therapy.
Yeah, no, I mean, I love that you laid that out too, because again, like you said, kind of not talked about enough, or just a huge pain point for the parents who feel like they're like, well, we've already treated the tongue tie, or we've already, like, you can pick any single step along that journey and think, okay, like we've put in the effort to try and fix this. And it can be really discouraging for some families to think, okay, like I thought we were doing the thing that was going to fix this, and now we're still dealing with putting all these pieces together. And so I think it's really amazing to hear that, you've been able to piece this journey together, not only obviously for your own kids, but I know you help guide so many other families in that path, but also, again, having that perspective, both that it can be a very overwhelming journey, but again, circling back, that sometimes we just have to pick what is the symptom that we're struggling with the most for each child. Is it feeding? Is it the respiratory illness? Like, where are we getting stuck? And like, what's going to make sense to dive in and try that? So again, I think there's so many little gems to be taken out of what you're sharing with us, and I appreciate that.
Yeah, I mean, and when it's your own kids, right, and you're the professional, like, it hits differently. It's no longer theoretical, right? It's emotional. Like, you make decisions not as a clinician, but as a parent too, who's like trying to get it right and learn as you go. And so, yeah, my kids are not going to need braces, but one's been in 3 rounds of expansion, the other one's been in 2, and now they're in Invisalign. So, like, that was basically their braces, right? And with watching my daughters go through expansion, it just gave me a deeper appreciation for timing, for support, for how we prepare kids for these experiences. And it really reinforced something that I tell parents all the time. And that's like, early intervention isn't about over treating. It's honestly about making things easier down the road. And I feel like that's what I got with my younger one, because I was able to start her journey at 5 days old, right? At birth, I latched her and I was like, oh, here we are again. Okay, this time I'm informed. I know what to do. And so I've seen firsthand like how giving them the right support early can really change their trajectory in a really positive way. Now, all that to say, if you're listening to this now and your kid's like 12 or 7 or 15, it's not too late. Like, there is still plenty that you can do. I will tell you, it may take a little longer, or there may be, sometimes it becomes a little more invasive in terms of the techniques or the appliances. But I, as a 40-year-old, mom, wife, daughter, granddaughter, all the things, right? I'm over here full on functioning adult with a MARPE in my mouth. So it's not too late. And I had all the earlier things, but I had the more traditional expansion appliances. It was not Airway focused. We were looking to straighten my teeth. We accomplished that. And then we stuck those, upper and lower permanent retainers in that really didn't do me any favors.
Yeah. And again, you kind of alluded to it earlier, but like seeing the lifespan, also the fact that you see adults and you see all stages of patients presenting with these issues, that's something that also I think sometimes we miss when we think about traditional orthodontics. A lot of times there's a window of time, or in years past, there used to be a kind of a window of time where patients were treated by an orthodontic office, released, and that orthodontist never saw what happened down the road. And so I think now there's been so much awareness building, both among professionals who need to think about this differently and among the parents and patients themselves who are advocating for themselves. So, really amazing wisdom. On the theme of wisdom, I wanted to just give you one more moment if there's any kind of imparting wisdom you want to share, and then we'll look and see if we've got some questions and we can go from there. We do have some questions lined up already. So, any last wisdom before we dive into questions?
Sure. I'll say something for clinicians and something for parents. So for
Great.
clinicians, stop like waiting till you feel ready. We need more of you in this like holistic, integrative airway space. Because you're never going to feel ready. Like that's just a false, it's a false falsity there. The field is evolving, right? And it's evolving quicker now than it was before, which is exciting. Because I mean, 10 years ago, I was like, oh, we're going to have it figured out in 10 years. And now we're here. And I'm like, oh, we still don't have it completely figured out. Like we're much further along. And I think a lot of us have it kind of figured out, but we're still working up against a lot of people who are not quite in the airway space, right? So that's what I mean when I say we haven't all quite figured it out. Start learning, just stay curious, get in the room with people who are thinking bigger. Like put your butts in seats or virtuals or like these kinds of conversations where it changes the way you think because you're being exposed to new information, right? And so seek out anything around like pediatric feeding that combines pediatric feeding with myofunctional therapy and airway and tethered tissues and or myofunctional therapy courses or airway courses or conferences where, you can dive into these topics and learn who is in this space that you can continue to learn from. I'm sure you guys have had people, you've had people on that they can probably go back and listen to past episodes. Like my podcast is a great place. So definitely listen to the people who are already in the space and who are kind of allowing you to think bigger. For parents, and I'll go back for 1 second. A lot of people go, okay, Hallie, like you ruined it for me. Like now I have my Myo eyes on and I can't unsee what I know and what I see. And I'm like, sorry, not sorry. Like you'll never go to the grocery store or an airport again without seeing all the open mouths and mouth breathing. And you're going to go, and now you all listen, you're going to be like, oh, I see it everywhere now, right? And it was interesting. I was at this business conference a month ago, and I'm sitting around a table, and we're all talking about what we do. And when I went to share what I do, I looked at them, I go, I have not sat at a table with 12 adults who are all nasal breathing. All of you have your mouth closed. I was like, I can't even explain to you how exciting that is. And they're like looking at me like I have 10 heads. I'm like, okay, now let me tell you what I do. I was like, I probably should have started there. For parents, trust your gut. Like if something feels off, feeding, sleep, breathing, maybe you're working with a provider and it just doesn't feel aligned and something doesn't feel, maybe you've already started the work and you're like, I have questions. You're probably not wrong, right? So keep asking questions. Like this is your permission to keep asking questions until you get answers that actually make sense. Because so many parents, I can't tell you how many have finally made it to like my private practice that have literally said to me, you're the first person who actually hears what I'm saying. You're the first person who's actually listened to me and didn't make me feel like I was crazy. And I'm like, you're not crazy. Like everything you said makes total sense. Like here's the intersection and how this is all interconnected. I'm like, but these other providers just aren't trained this way. They're not trained in this the way that I am. And so it may unfortunately make sense that they did not connect with what you were sharing with them. And clearly I need to do a better job of informing them who to refer to me. So, keep asking those questions. Don't feel like you're taking up space. Like you and your child deserve the absolute best care. And so unfortunately, we're still in a place where you have to advocate for that. And it's not the providers who are going to be always advocating for you. Just kind of for everybody, parents, providers alike, zoom out, like look at the whole person, not just the symptom. And look for solutions that don't just slap Band-Aids on the symptoms and don't just try to fix the symptoms, but actually look for like the root cause behind the why, right? Like, why is this happening? Because that's where the real breakthroughs happen.
Love that. Excellent wisdom. Thank you, Hallie. So I'm going to pull up some of the questions that are coming in and we'll go ahead and jump in there. So the first question here is, how young is too young to start myofunctional work, which I do think you sort of did address, but I'll let you kind of revisit that.
Yeah. So generally it's age 4 to 5 cognitively. So what we mean is like the child needs to be functioning at the cognitive level. So following directions of like a 4 or 5-year-old. Some kids are still too young then and they're not quite ready for it. And so they might start a little later. That said, that doesn't mean we wait, because my course, I have a course called Feed the Peds, and we train SLPs, OTs, and PTs in how to do pediatric feeding. But within that course, we're teaching them the goals of myofunctional therapy, how to address tethered oral tissues, tongue ties, lip ties, cheek ties, et cetera. And like when to refer to these other airway providers, how to get a team built with a younger child. And so all of it is still very addressable, like from birth. So that's where, find that pediatric feeding therapist who is trained in all of the above, or if they're about age 4 or 5 and they can follow the directions of a 4 or 5-year-old cognitively, then you could start traditional myofunctional therapy. And that goes all the way through adulthood.
Love that. Okay. The second question here is, what are the signs in a baby or child that parents usually miss until it's pointed out?
Okay. So I would say that sleep is a big one. I feel like a lot of parents come to us because the baby's struggling with feeding, but we are looking deeper into airway and how that's impacting sleep. And like we know newborns don't sleep great, right? They wake up a lot, or maybe they are sleepier. My child would not wake up to feed. So I had people telling me, "Oh, you need to blow on her and throw water at her face," and I'm going like, "What? Like this is a newborn." Like literally, a lactation consultant was like, "Get some water and just like spritz it at her face," and I was like, "We're not." She was like, "Get her naked so she's cold." I was like, "These are all horrible." Suggestions. Like, am I trying to disrupt her nervous system more? Like, what? So I was like, okay, thank you so much. Like, moving on. I think parents don't realize, like, yes, babies have like these sleep wake cycles that very much so function around when they're hungry or they have wet, or dirty diapers. But if your child's not waking to feed, like early, that's definitely a sign. Children who, as we get even a little bit older with sleep, children who sleep really well through the night, meaning like, oh, I put them to bed and they sleep 12 hours and they don't wake up. That doesn't mean they're getting restorative sleep. And so like this is probably the number one thing that I think parents miss and don't realize how it's all interconnected. If your kid is waking up and they're still tired, they've got those bags under their eyes, those allergic shiners, for not going into all the technical terms, but they're constantly sick, they're draining, they're feeding, their nose is draining, they're drooling, maybe their mouth is open. Some parents don't even realize that the kid's mouth is open, right? But it all kind of ties back to like how the airway is functioning. And so while we've been talking a lot about feeding and myo, I think the airway stuff, like impact on sleep. I'll tell you then, I had this one patient. She was 3 years old. She wasn't my patient. I was in a private preschool dropping a kid off at their class after therapy. And I looked over at one of the teachers and I was like, is that child sick, or does she always snore like that? And they're like, oh no, she always snores like that. And you could hear this kid down the hallway. I was like, okay. I went to the director. I was like, listen, I'd love to do a free consult with this family. I don't want to overstep my boundaries, but I actually have like serious concerns about this kid. So they do put me in touch. I do a consult. This kid was rushed in for an emergency tonsillectomy. The child was at risk of like SUDEP, like sudden unexpected death from, well, not epilepsy, but they were worried that this child was going to have, was going to die in their sleep because of airway issues and blockages. And they were worried about what was happening at the brain level. This child was turned around at circle time, not responding to their name. I started working with the kid because the parents were concerned about speech and language development, but then we added feeding in. And so after this kid had that tonsillectomy, night and day. And this was a kid where the parent was a medical professional, and had no idea. The kid she sleeps great, 12 hours a night. Great. She sleeps 12 hours a night. She's a hot mess. Like, she's not getting restorative sleep. Her airway doesn't allow for it. And so this child went from, again, turned around at circle time, not responding to her name, delayed across the board, to finally getting restorative sleep. And within a couple months, responding to her name, turned around, completely engaged, skills falling into place on level, all because she could breathe. And so it's a really extreme example, and not every kid presents like that. Like they said, this kid's airway was like, or snoring was worse than a middle-aged overweight male. Like the ENT was like, I've never seen a kid this severe. So very extreme example, but it just goes to show how important sleep and like the airway is during sleep. And I think a lot of parents they're like, oh, my kid sleeps great. I'm like, great, send me a video, go take a 3 to 5 minute video, like right after they fall asleep, then go back an hour later, then go back one more hour later. I want those videos so I can see what they're doing because we can see things that the parents are just not trained to see.
Yeah. Amazing. Yeah, the first step is so often awareness, and even with a medical background, we don't all get the same training in these topics. So I think that's a really great case that you've laid out. Um the next question here that someone asked is asking your thoughts on the Dr. Evans type expander for children. So I imagine that's the Mariana Evans expander if you have thoughts.
Oh, so she's been on my podcast, but I haven't personally used that expander. And as a non-dentist, I'm not going to offer any opinions because I don't have personal experience with it. So I don't know if you have any experience or thoughts on it, but I can only really speak to what my kids have used personally. I know people love her, so that's what I'll.
I would echo that as well, that she's a brilliant mind in the field, and if she invented it, I feel pretty good about it, but that's just
Yeah.
I'll leave it at that. The next question is, how do you coach parents through post-frenectomy stretches without traumatizing the kid or the parent?
Yes. So this is a great one. I'll try to keep it really short. So first of all, that pre-op therapy, right, that you're doing is so critical because we rehab to the point where we can't really rehab anymore. Like we kind of hit that wall, like we talked about earlier. And that's a good sign because now what ends up happening, and little kids can't really voice this, but the older kids we've worked with and the adults often feel this, they'll be like, oh my gosh, I couldn't move my tongue this far before. I couldn't put my tongue there. Or this hurt before. This doesn't hurt anymore. Right. So they can start to actually voice the differences they feel post-op. And that's not the only reason why pre-op is really critical. But in that pre-op, we're also getting the family's nervous system regulated with the kid's nervous system. Really important. If they're just regulated, nobody should be going for any type of a release. We need everybody we call it rest and digest, not fight or flight, right? Fight or flight when everyone's kind of like, everything's like, right? It's that like sympathetic versus parasympathetic mode. And so we need everybody calm, cool, and collected. And one of the ways that we can really help families do that is practicing and making sure they can do it on themselves. They do it on me. They do it on their child beforehand so that when it comes time where their kid has now had the procedure and they're a little bit anxious because they're like, I don't want to hurt my kid. No one wants to hurt your kid, right? Now we can go, you got this. And let's bring them in and make sure they got this. And let's work with them. And if they're not pushing hard enough, like we can have them practice on a hand. We can have them, a little bit more pressure or a little, whatever it is that we're trying to help them with doing. We want them to feel so solid and so good about it going in. It's much better to have the child. And listen, we're looking to send our kids to a school next year where like grit and self-paced learning, like they're driving their own, learning and all these life skills that we want to teach children. Not everything in life feels good, and that's okay. If we are going to do this, we have to understand that they may be uncomfortable for a little bit, and they're going to be okay. They're going to be okay. It's much better than it reattaching and having to go through the procedure again, because then we have even more time they have to be uncomfortable. So let's try and get it right the first time, right? So I talk to parents about that and about how children cry sometimes. And if we expect it and we can hug our babies afterwards or hug our children afterwards and be like, I'm so sorry I had to do that. But that's life. So I don't know. I just think we've gotten really soft as a society. Not that any of us want to hurt our kids. It's hard, right? As a parent who went through this with both of my children, and then I had a tongue tie release myself as well, I get it firsthand. It doesn't feel great. But again, I think that pre-op practice is so critical so that you're truly everyone's nervous systems need to be regulated. And then the after it goes so much better.
Yeah, it may be hard for you all to appreciate the wisdom that Hallie just dropped, but as as someone who has offered frenectomies for patients, I primarily focused on infant frenectomies, but I would always say the hardest part is it's going to be almost the hardest part on the parent to go in and do those stretches because they do feel the remorse. And doing that practice in a calm state of mind is everything so that it can't first be introduced like here's your tongue tie, go home and figure out how to do this. That is not going to be a good way forward. So there was a lot of wisdom there. Thank you.
You're welcome. We used to get calls. Oh, we just had our tongue tie released and we were told to call you. I'm sorry, what? You want to see me today? Like, uh, where were you 3 months ago? Yeah. Yeah. So
Yeah. And again, that's not on the family. That should be the providing team that should be setting you up with the right information from the get-go.
yeah. Yeah.
So
The other thing I will like a takeaway from last night at this new school thing was he said we in education, because this applies to adults too, we blame the kid when they're failing. But it's not the kid's fault. It's the educator's fault. If the kid's not learning, that's on you. That's not on them. So I go back to as a provider, if the family is failing at this, if they feel like they're failing, if the child's not progressing, that falls back on me. Now, listen, yes, maybe families aren't doing the homework or I've had families do minimal homework and still have really great success. So it goes back to like, how are we interacting with the family and their goals? And are we keyed in enough that they trust us and we built rapport with them that they know, okay, this is the plan. I feel really solid. I feel really good about this. Like, I got this. And they also know they can contact us if they don't got this because we're all human. So I think we have to bring the humanism back into practice. And I know we're all busy, but if you're going to do this kind of work, there's got to be a lifeline. There's got to be communication between the provider and the family and not like 3 steps to get there. It's like we need direct communication, especially in the healing process, like right after procedures.
yeah, and I think that unfortunately that's part of the learning curve for the providers as well. I can say that humbly because a decade ago I don't think I had taken my first tongue tie course was in 2017 or 2016. So I know what it's like not knowing this world, and it takes a lot to properly get to the point where you're thinking about it correctly. And so finding people like Hallie who can, like she said, go sit in the room with someone who knows what they're doing and learn how to do this with the right mindset. It makes all the difference.
Yeah.
All
And I
right,
didn't
we've got,
hear either. Like I
yeah.
also, to preface this, I learned later in my, not later in my career, but years into my career. So there's a lot of us that kind of fell into
Mhm.
this, right? We didn't all start here. So for the therapist starting here, like, yay, welcome. I'm so glad you are.
Yeah.
You're just like,
And you said that too about the dentist too, like the heroes that were willing to treat your kids early because not like
yeah,
that's just not widely available.
yeah.
So again, we welcome the heroes among us, but also know that the parents you still have to make sure that you're getting the right support. It really lands on both sides of the conversation. So all right, two more questions I will lay out here. One of the questions here is what is the effectiveness of RF radio frequency on the tongue?
So that I am not personally experienced in. I don't use that myself. So again, a modality I won't speak to per se. I would maybe do some research or see if you can find a provider to talk to about that uses it.
Yeah. And then the next question is what should we screen our children for before going to see an orthodontist?
Oh, I love this question. So I actually do a free screener like training and it's coming up the first week of May. And so it's really geared towards professionals. But if you're a parent or a professional that maybe doesn't check the box, you're more than welcome to join us. I have a whole like I've created a pediatric feeding screening and I've created a myofunctional therapy screening. I will say the overlap between the two really goes back to airway. So I look at the face, I look at airway, how are they feeding? I'm not going to go into all like the nuances and everything, but I think if you look at that, if they have speech, what does their speech sound like? So it's fast. And then the tongue. So how is their tongue functioning as well? Does their tongue live in the roof of the mouth? Is it down on the floor of the mouth, sitting on is it sitting on the lower lip? Is it pushing against the teeth? Is it between the lips at rest? We see all these different presentations. The tongue should not be low and forward. It should be up. Is the mouth open or closed? Right? When I say airway, I'm looking at like, that's the most obvious thing you can screen for. If your kid is playing or watching TV or they're in the car and their mouth is just hanging low and their tongue is sitting low, or if you hear them breathing, breathing shouldn't be audible, asleep or awake. So, like even that, right? They don't have to be snoring. I know on the sleep disorder breathing scale, I know Guillermo kind of regretted it at a certain point having given these scales because he was like, no, even one incident of sleep disorder breathing in a child is still not. It might be common, but common does not equal normal, right? And so we need to remember that these kids should have, like, well, and adults too, right? I think closed mouth, tongue up, so lips together, and we're breathing through our nose. And then the teeth, at rest, where the teeth at rest as well. So I don't know if that helps, but just kind of looking at those things initially to screen.
Yeah, I think that's super helpful. Well, thank you. That brings us to the end of our time for the Q&A. So thank you so much for spending your time with us, Hallie, and thank you to the Get Expanded community for joining us for this conversation. JP, is there anything else you want to add before we sign off?
No, I just want to thank both of you guys for taking the time today, and thanks to the audience for tuning in. And yeah, until next time.